Hello, friends, and welcome to Activate and Thrive and our weekly Thriving Thursday interview, where we chat with different, beautiful, health-minded souls in this wide, beautiful world of ours. We have these every Thursday at noon Eastern US time, and they last just about 20 minutes or so. So thank you so much for joining us, whether you're live with us now or watching this later here or on YouTube. We're very happy to have you here today.
Our guest today is Dr. Dirk Leverant. He's in Phoenix, Arizona, and his background is a little different. He has a medical degree. He also has a degree as an attorney, and he worked as a medical attorney for years, and then as a consultant on medical cases. And then he left the, shall I say, rat race, the high pressure of that world, to just enjoy time with his family. He loves to hike, he loves nature, he loves traveling, he loves camping and animals. And just lately, he and his wife have been showing others how they can live a healthier lifestyle, how they can feel better, sleep better, so they can do more of what matters to them. And his wife is also a doctor. She's an eye pediatrician specialist, retired one as of December of 2020. And the two of them have just been sharing ideas with other people about how to live a healthier life. So, Dirk, my first question to you out of the gate here is, why this change to go in this direction, to just share with others, you know, how they can live healthier?
Well, it's interesting. I've been thinking about that a lot, especially over the last few days, because I've been, getting together with a lot of people that we've been working with, and everybody's, they all bring their own story to why they're doing what we're doing. And actually, I was thinking about why I originally went into medicine, and I started in medicine. Um, I'm old enough that I remember Marcus Welby, and I remember the doctor going to the people's houses. And if you needed 2 hours of his time, he was there for 2 hours. And when he left, you knew what was going on, and you knew that you were in good hands. And then when I was a kid, I read the book MASH of all things, and I fell in love with not the story, but the doctors. I fell in love with, in particular, the anesthesiologist. I actually remember specifically reading how nothing mattered in the operating room except the anesthesiologist, because his hands literally kept a person alive and made it possible for all the other doctors to do the wonderful things they did. And to me, that was medicine, and it was all about helping and making people well again. And so, I essentially blindly followed that path all the way through medical school, and got out into the world of medicine and went, holy smokes, medicine is business. And it wasn't about helping people. It was about how many patients can a person see in a day? How quickly can you get them in and out of your office? How little can you do to see more people so that you can generate more income for a practice, a corporation, a business? And it was not what I wanted to do with my life. My life was, the whole purpose was to try and help people, and here I was basically trying to build a corporation for Cigna or something. And that just wasn't what I wanted to do with my life. So I, of course, made the obvious decision to go into law school. And but again, and most of the people that go into medicine, and most of the people that go into law, when you go into these fields, you do it with the idea that you're going to go out and help people. And somewhere along the way, that seems to change, and you get kind of you get pounded into the mold of, well, it's just really a business. And they did the same in law. And so for about 20 years, I actually did medical law, where I was trying to help people that had been harmed and needed to get, the money to pay for their futures. And that's what I've done for the past 28 years now. But it got to the point where even working within the legal system to help people, no longer was helping people. And I started looking around and going, what can I do that can make a difference directly in people's lives? Because trying to do it the way I was doing it wasn't making a big difference for people. And I spent a lot of time getting to a place where I wasn't helping, and that was disappointing.
Mhm.
So,
Yeah.
No, I totally understand that. It's the reasons why people get involved in the first place just totally change. So,
So, it's so that you ended up leaving that space and basically entering the natural health and wellness arena. we understand. And you know a lot of stuff. Today we want to talk specifically about omegas and
Yeah.
in relation to our health. So let's just dive right into that. Just tell us why omegas. What do omegas do for us? Just like an overview of omegas. What are they good for?
Well, it's interesting that omegas. I call them, I call them a good fat, because when people hear fat or fatty acid, they immediately, their head goes to that place where they think fat's bad. And fat's not bad. Fat's one of those things that we need in our bodies. Um, what most people don't realize is that every cell in your body has what's called a cell membrane around it. And back in medical school, they teach it, and they teach you that it's what's called a lipid bilayer, and lipid is fat. And
Mhm.
every cell is surrounded by two layers of essentially fats. So you need fats just for your cells to even exist. And then in your nervous system, the nerves are surrounded by a covering called myelin, which is, again, it's a fatty covering, and the myelin helps the nerves do their job so that they can send signals from the brain to the muscles, and pain signals to the brain, so that the brain knows that something's hurting your body. If your nerves don't function properly, uh, obviously that's a problem. And so you always see, I'm always amazed when I look at like bodybuilders and these people out there that are, that are ripped, and they're, 3% body fat. The first thing I think of is, I'll bet their brain isn't working very well, because they don't have enough fat in their body um, for their cells to have the right integrity. And I worry about people like that. They're so focused on cutting fat, and omegas are the good fat. They're the primary source of that lipid bilayer, that surrounding for every cell in our body. So we need those. And if you start thinking about what all the different cells in your body do, what are all your organ systems doing? If you take away the function of any of those cells, you lower the function of every one of those organ systems. So the omegas are important for just a myriad of different body functions. And there are actually four different omegas. People always kind of lump them all together and say, oh, we're going to talk about the omegas. And most people actually spend all of their time thinking about omega-3. That's the one that gets all the press, if you will. But there are four different omegas. There's an omega-3, an omega-6, an omega-7, and there's an omega-9. And there's a lot of overlap in what they do, but they each have kind of their own specific area where they're really helpful. And also, if you don't happen to have enough of them, in particular the omega-3s, then you start running into problems. So not only do you need them, in general, but if you have a deficiency, you can actually have health issues from too little omega in your diet. So essentially, what are they? They're called fatty acids. They're just long chains of molecules strung together. They're fat. If you see them, well, I mean, Crisco, you see them in your cupboard. They're greasy, slimy. They're
I
fat.
don't have that in my cupboard.
Well, tell us, Dirk. Well, let's use me as an example. So I was not always as health conscious as I would have liked to have been, and that has, of course, all changed for me. So previously, when I didn't even think about omegas, certainly didn't take any. Um, what was happening to me versus now, when I'm very aware of that and actually taking a very beautiful omega today? Well, what was going on for me?
Well, I think the easiest way for me to do this would be to maybe just kind of go through each of the omegas and what they do. Would that work?
Okay. Yeah,
Mhm,
that'd be great.
mhm.
Because I mean, assuming that you weren't getting them, and you weren't taking supplements of any sort, and if you
It
didn't
was
have
not.
them in your diet, like I said, the first omega that everybody thinks about is omega-3. And that's the one that everybody says, oh, you got to get your cold water fish, your salmon, Norwegian cod, stuff like that. Or it can come from plant sources: flaxseed, chia seeds, walnuts. Um, and one of the things to understand about most of the omegas, three of the four omegas, is they're what's called essential fatty acids. And it means that they're essential to your diet. You can't make them, your body can't produce them.
Mhm.
Omega-3 is an essential fatty acid. So if it isn't in your diet, you don't get it into your system. So if you don't have a diet that's rich in cold water fish or the various plant sources, you'll end up with a deficiency. And omega-3s are really, really important for the neurologic structures, the brain, the eyes, um, pregnant women, especially for developing fetuses and children when they're young. Um, you always hear that the brain isn't developed when kids are born, and that's true. So as the brain's developing and it's laying down all those nerve cells, it's got to be creating all those cell walls, and it's got to be building up all that myelin I was telling you about so that the nerves function properly. If you have a deficiency in omega-3s, those don't develop properly. Other places that need a lot of omega-3s are your retinas. If you don't have enough omega-3s, your retina, the cells at the very back of your eye, don't develop properly. And those people start having vision problems and have issues with, you hear about macular degeneration and all these other things down the road. I'm not going to say that this is the cause of it, but it certainly is an influencing factor that can kind of, they can lead to worsening. So, and if you think about it, I mean, the eyes are basically just a direct extension of the brain. The optic nerve comes straight from the brain to the back of the eye into the retina. So it makes sense. So like I said, things like the nervous system and the retina they need omega-3s. And if you're not getting them, the chances are you're going to have issues with anything that involves your nervous system. Interestingly, omega-3s have been shown to be really protective against a whole variety of different diseases. Breast cancer, of all things. I can't tell you how a lot of these work. All I can tell you is what the research shows. And people that have sufficient levels of omega-3s tend to be protected against breast cancer, depression. Depression makes sense because obviously it's a neurologic issue. ADHD, they have a lower incidence of ADHD. All of the omegas tend to be protective against inflammation. And one of the things, and here's something that kind of, I don't want to say it drove me nuts, but I'm stunned at how much we have learned since I left medical school. When I left medical school, most of the stuff that I'm dealing with now wasn't even spoken of. Nobody talked about things like inflammation, oxidative stress, stuff like that. It was as if you got a disease because it was a disease. It was never like there was an underlying cause. What's really causing that disease? And we're finding out that inflammation underlies literally hundreds of different disease processes. And all of the omegas have a protective component that lowers inflammation. And it's pretty simple math. If you can lower inflammation, and inflammation causes disease processes, you're lowering disease processes. So by lowering inflammation, we found that the omegas are helpful in things like not treating, but in forestalling or preventing Parkinson's, Alzheimer's. So there are a tremendous number of positive effects of having a sufficient amount of omega-3 in your diet, if you will. So that's omega-3. And again, that's the one that everybody talks about. And it's essential. You need to put it in your diet. And most people don't get enough in their diet. And I'm a little later on, I'll mention there's a kind of a ratio, if you will, about the different omegas and what
I was just going to ask you that.
Well, okay, well, we'll talk about that now. The next omega that I was going to talk about is omega-6. And like omega-3, it's essential. You need to have it in your diet, but it's in so many places in our food sources that most people have a tremendous amount of it already in their system. And I used to have a little bottle of my omegas that I was taking here because it was omega-369. And it was a very expensive, very high quality omega. There should have been no 6 in it. We don't need omega-6 typically as a supplement because we get so much of it in, it's in vegetable oils and it's in nuts. And all the processed foods are processed with forms of vegetable oil in them. So we get a tremendous amount of it. And you're supposed to have a ratio of roughly 1-to-1, omega-3 to omega-6 in your diet and in your system. I've seen anywhere from 10 to 30 times the omega-6 to omega-3 in a typical American diet. Yeah, so you're literally getting up to 30 times more omega-6 than you need in your diet. And here's the really weird kind of contradictory thing about omegas, with omega-6 in particular. Too much omega-6 leads to inflammation. I mean, how is that for a paradoxical consequence? It's good for you, but too much of it is not only bad for you, it actually causes the very thing that it's supposed to be helping you treat.
Like many things, too much is not a good thing.
Yeah, but it struck me as really almost funny that you're using it to stop inflammation and it's causing inflammation. And that causes tissue damage. It also has been known, too much omega-6 has been known to cause an autoimmune reaction where your joints start having almost an arthritic reaction.
Wow.
So you really want to balance the omega-3s and the omega-6s. And one of the things that you probably want to do that balancing is not take a supplement that has an omega-6 in it, because the chances are you're already getting way more than you need to begin with.
Mhm.
So anyhow, the right amount of omega-6 is actually good. It actually is protective against both inflammation, and it helps balance cholesterol, which obviously we all know is a good thing, because I think heart disease is still the #1 killer in America right
Yeah.
now.
Yeah.
So then the third omega that I want to talk about is omega-9. And just because I want to make really kind of short shift of this, omega-9 is the non-essential omega. And the reason it's non-essential is your body can make it out of the other stuff that you take in. So if you're low on omega-9, your body creates it. You don't need to be supplementing it. It's not bad to be supplementing it at a low level. It doesn't hurt you, but there's no need for it. It's, you're already making it. So again, people take these omegas 3, 6, 9. Well, you need the 3, you don't need the 6, you don't need the 9, and you're paying for both of them. I don't know why you would want to do that.
Mhm.
It's a very, it's a good omega. It's important to your health. It's very useful in balancing your cholesterol. You all heard good cholesterol, bad cholesterol, the
Right.
high density, low density.
Mhm.
It has the impact of kind of stabilizing that, raising the high density cholesterol, which is the good stuff, lowering the low density cholesterol, which is the stuff that tends to form those plaques that lead to heart disease. So you don't want that. It also has the interesting impact of balancing mood. Omega-9 is very good for keeping people in a positive frame of reference, in a positive mindset, if you will. But it's really easy to get too. You can get it from cooking oils, olive oil, safflower oil, avocado oil, stuff like that. So it's really easy to incorporate omega-9 into your diet without having to worry about supplementing it. And if you don't have enough of it, your body will make it. And that leads me to the last one, which is omega-7. And actually, I kind of like to leave this one to last, because this is one of those things that we never heard about in medical school. I mean, they literally refer to omega-7 as the forgotten omega, and it's remarkably important. People don't realize this. It's an essential omega, which means you can't make it, but it only comes from a really limited number of sources. One particular plant source called the sea buckthorn, I think it's called, which is a kind of a funky plant that has berries on it that are inedible unless they're processed right. And if they're processed right, you can get the omega out of them. And then you can also get it from things like macadamia nuts. But I mean, if you supplement your diet with just macadamia nuts for your omega, you're going to be taking in so many calories that you're really not helping yourself, are you?
Mhm.
So you can also get it from dairy, but it's got to be dairy that has fat in it. And most of the stuff that we're getting in the stores nowadays is low fat, no fat, low fat milks, low fat yogurts, I when I cook, I try and get Greek yogurt with fat in it, because I like the texture. I like the omegas. You have to go searching through. There are 200 things of yogurt on the shelf, and you may find 2 or 3 of them that have fat. So you're not getting the omega from the dairy, and we used to be. So, that's one of the ones that you probably have to supplement. And omega-7 is kind of remarkable, because it has just a number of health benefits that nobody even, was looking at a while ago. It lowers your triglyceride levels. It lowers your cholesterol levels. It supports your gut health. And I mean, we could go, if we had another 2
That
or
would be
3
a
hours.
whole nother
Yeah,
conversation.
we could go talking gut health forever, because they're finding stuff out about gut health now that is stunning. Like you said earlier, my wife is also just retired as a physician, and we've been diving into this stuff recently. And oh my God, I feel like we're in medical school again, that the things that we're finding out now about gut health, oh Lord, I could go forever. But so omega-7 is important for gut health. Um, it's important for the integrity of your skin, your nails, your hair. I mean, you want to look good. You want to have that nice, healthy look to you. You need omega-7. It's also extremely important in balancing your immune response. But it's got a couple actions that nobody would have even thought to look at a few years ago. One of the things is, for some reason, omega-7 tells your body to burn fat and to burn sugar and not to store them. I'm not sure how it works. They just know that it does. So a lot of times when you take in sugars and fats, your body stores them. It takes the excess and stores those as fat for use later. Omega-7 tells the body to not only burn the fat you're taking in, but to burn the fat that's already there. And this is really important because it specifically targets that belly fat, the gut fat,
That
the stuff that you
visceral.
don't
Yep.
see. Yeah, the visceral fat that nobody sees, that even those skinny people running around out there have.
Yeah.
Omega-7 tells the body to break that down and burn it as fuel. And it also has an effect on the cells. It's called a signaling molecule. It tells the cells, every cell in your body, to be a little bit more receptive to insulin. And what that means is, when people become diabetic, it's because their cells don't respond to insulin to take in glucose. Don't want to get too sciencey here, but as the cells become resistant to insulin, your body has to start putting out more and more insulin. And that's why eventually people end up taking insulin shots. They've got to raise the insulin level up to a high enough level that the cells will react. Omega-7 lowers that level. It makes the cells react at a lower level. So if somebody is, say, pre-diabetic and kind of on that verge of tipping over, omega-7s can help those cells become more responsive and keep them from making that trip, if you will, into diabetes. So it's got just remarkable health benefits,
Yeah.
and it's in almost none of the compounds that are out there.
So we really need to be getting that into our system. Well, Dr. Leverant, we are amazingly reaching the.
No, I want to ask him one more thing.
Yes.
Sorry.
Okay. Yes.
So we're talking about these omegas, and we're talking about the benefit of brain health, heart health, skin health, reducing inflammation in the body and how it all works together. But how do we know that we're taking a good quality omega?
Right. I was also going to ask that, because I know that you have a very special one that you take, and we also take the same one, and we highly recommend this one to people. And if people want to know more about it, they could contact us, and we can tell you. But what do you look for in a good omega, just quickly, and why is the one that both you and we are taking so good?
Well, there are a couple things. Like we said, there's 4 omegas, and half the time people are paying for 2 that they don't need. What I like about this one is it has the omega-3. It also has the omega-7, which makes it relatively rare in the marketplace. I mean, that right there cuts out 95% of their competition, if you will, because they don't include it. The other thing that I like about this is people don't realize that, the omegas typically come from fish oils. Like any other oil, they can go rancid. If you don't get something that's fresh, you have no idea. They oxidize just like everything else does. I mean, everybody's seen the picture of the apple when you cut it and it turns brown. That's oxidation. It breaks down. Omegas and all the other oils do that too. I mean, if you've had a container of walnuts in your cabinet for a while and you open the bag up and it's got a weird smell to it, that's the oil in the walnuts has turned rancid. So you want to be able to get an omega that you know is fresh and has been processed recently. And one of the things I like about ours is that I can literally go to this company and I can give them the lot number and they can tell me where my omegas came from. They can literally trace it to the boat and to the date that they got those fish. And so it's been processed recently. The other thing I like is I know that, well, a couple things. One, this company is an American company. I know that our products are made in America. I am, quite frankly, very nervous about taking things that are made in China and other places. I don't know what the quality control is there. And I also know that every batch of every item in these omegas is batch tested. And so that's how I make sure that what I'm taking is not only safe, but high quality. The other thing is, quite frankly, I've had omegas before. I've had other omegas. They give you those ridiculous fishy burps and they smell terrible. I didn't believe it when I was told that you could chew these, so I did. I took one and I munched down on it, and they taste clean and they taste fresh, and there's none of that
citrusy, right?
Yeah, absolutely. They almost a little lemon limey to them.
Right.
And it was like, you know what? This is great. No fishy burps. I feel good. I know that I'm getting really high quality ingredients that have been tested and are fresh. So that's how I make sure for myself, is by using this.
Yeah, I just bit down on 3 before this.
Well, we would love to keep on going here. It's such an important area, and you've really laid out the benefits and also the cautions related to like omega-6s. So this has been very, very useful and instructive. It's been great to chat with you. And
is there anything else you want to just end with? Any final tip?
You know, Not
mean, you've
really. I
been
mean,
great.
it's a lifestyle choice. You know, taking omegas is great for you. It's good for you. But I was on a meeting the other day, and one of the people that joined us remotely, you know her, is Dr. Silverman, Sveta Silverman.
Yes,
Yes.
yes.
She is a remarkable health focused physician, and she was practically yelling at us that you can take any supplement, you can take any products you want, but if you don't incorporate a healthy lifestyle, you're basically pouring a Dixie cup of water on a fire. It's got to be part of an overall healthy lifestyle.
Right.
Yeah, there's no be all end all one choice magic pill and then you're good and ready to go.
Well, I think that's a great final tip that omegas are part of an overall health strategy.
Absolutely.
And so we really, really thank you so much for joining us today, Dr. Leverant. And
Great value.
yeah,
Thank
great
you so
value.
much.
And friends, again, if you'd like to, even if you'd like to engage with Dr. Leverant and ask him questions, we can connect you with him, or
Absolutely.
you can message us and find out more. Again, we are all taking these beautiful omegas that Dr. Leverant just talked about. So thank you so much for joining us at Thriving Thursday, and we wish you a beautiful day. And we'll
see you next week.
Sounds good.
Thank you,
you.
Dr.
Thank
Leverant.
you.
Bye.
Bye-bye.